I would like to say welcome to everybody who has joined our webinar. And we've tapped some IPS resources to help guide us through the process of leaving home and going back to work. Uh, Paul Jennings, Executive Director with the Center for Industrial Services, will make an introduction of two employees that work there and have special knowledge and expertise in this area. As we go through the process, we will have time at the end for questions. If you'll notice at the bottom of your screen, you have the ability to Q&A. And if you click on the Q&A, you will be able to submit questions to the panelists, and we will get those answered as best we can. So, Paul, would you like to introduce our panelists for today?
Sure. Thank you, Scott. And special thanks to everyone for joining our webinar this afternoon. Brian Lane and Walter Idle are our presenters today. They'll be discussing things we can do to stay safer as we return to our workplace during COVID-19. Brian and Walter are highly experienced health, safety, and preparedness professionals. They've trained thousands of people and assisted hundreds of companies during their many years with the Center for Industrial Services. Brian Lane leads the Southeastern OSHA Training Institute in Tennessee. As an OSHA authorized outreach trainer, Brian develops and delivers safety training, conducts safety audits, and develops OSHA compliant safety programs for Tennessee companies. Walter Idle leads the CIS Emergency Preparedness Program. He develops and delivers safety and emergency response training programs and audits to manufacturers, first responders, public works, and healthcare organizations. Walter specializes in training responders for confined spaces, trench and structural collapse, and machinery rescue. So, Brian is going to start us off with a short presentation and then turn it over to Walter for his presentation. Remember, as Scott said, that we've muted everyone, so be sure to use the Q&A function at the bottom of your screen to type and submit questions. Feel free to submit your questions at any time, and there will be time for Brian and Walter to answer questions toward the end of the webinar. With that, I'll turn it over to Brian Lane. Brian?
Thank you, Dr. Jennings. Like he said, I'm the OSHA safety person for the center. In that capacity, I travel around the state trying to help people with safety and health issues. And back in February, I was actually doing an OSHA 10-hour class for a warehouse and distribution center in Middle Tennessee. And at that time, some of the gentlemen in the class were concerned because they were receiving containers from China. And so they were worried, would this new flu that's coming from China possibly be able to make it to them? Could they be contaminated? And I answered their question with an answer that I often give: I don't know, but I will find out. So I actually went to the Centers for Disease Control, CDC website, submitted a question, and they answered it. And so I'm going to jump now to PowerPoint if I can. And let's see, share screen. So is everybody seeing this on the screen now? Yes, all right. So okay. This is awesome. Unfortunately, one of the things that I have not done very well with is learning how to use the technology. So I'm going to stop the share at this point because I've obviously done something wrong. But I can still keep talking to you and say that the CDC responded to me, and they said to me that, and I'm quoting here, while we don't know for sure that this virus will behave the same way as SARS and MERS, we can use the information from both of these earlier coronaviruses to guide us in general. Because of poor survivability of these coronaviruses on surfaces, there is likely very low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperatures. The point I'm trying to get to is this. That has changed over time. And they're now saying that that stuff can survive on surfaces for a period of time. There we go. Okay. That doesn't take, I'm an older guy. It doesn't take me too long to figure out how to press buttons. So let's see if I can do this right. So the point I'm trying to get to is that how do we know where to go? Where can we go to get information? And I'm going to try to use my few minutes to help you with that. So this is I'm not an infection control guy. I'm not a medical person. My boss, Mr. Idle, who's going to be following here, he's the smart one in the group. And he not only knows about infectious diseases, he has an infectious smile. So you'll get to witness that today as well. So this is from the dumb old safety guide. This is a kind of a basic tenet I've lived by over the years with health and chemical stuff. If it doesn't get on you or in you, it can't hurt you. And I think that that's going to be true as we move forward because this stuff keeps changing. So where can we go to get information? And what I would respectfully submit to you is, if you haven't been there, please go to the OSHA website, which is www.osha.gov. This little PowerPoint presentation that I'm stumbling over right now, by the way, is available for anybody that wants a copy of it when we're done. Mr. Idle's got our contact information at the end of this program. So if you type in www.osha.gov and you go to their website, one of the first things you're going to see is this coronavirus resources, learn more. Now, I would encourage you at some point to also take a look at some of the other stuff on the website, like the standards and so forth. But if you click on learn more, you will see that it'll take you to a page with a bunch of wonderful information. And if you can see it, I don't know if you can see it, but under news and updates, they just issued guidance for dental practitioners yesterday, May 11th. So the point is, they're constantly updating this site. And one of the things under highlights that I want to call to your attention that we're going to come back to in just a moment is called Guidance on Preparing Workplaces for COVID-19. Okay, so we're going to come back to that in a second. But if we go on down the page, we'll see hazard recognition, standards, control and prevention, medical information, all of this wonderful stuff is available and paid for with our tax dollars. So I would recommend that you go there. One of the things that you can download from the OSHA website that's easy to understand is 10 steps all workplaces can take to reduce the risk of exposure to coronavirus. I'm not going to read through all of those. That's available on the website. And Mr. Idle is going to talk about some things that you can do to protect your workplace and your workers. But here's the guidance on preparing workplaces for COVID-19. Now, they came out with this at the end of March. And here's the table of contents. Again, I'm not going to go through the whole thing. I'm just going to show you what's there. And so one of the things that I want to focus your attention on right now is steps all employers can take to reduce workers' risk of exposure to SARS-CoV-2. Walter, I don't know what the correct pronunciation of that is. You can help us with that later. But if we look at that, the steps, here are the steps. So again, I'm not going to drill down on this. I don't have time. But these are some things OSHA is saying that you can do. So this is not, these are not standards. One of the questions I was asked yesterday by a person from Chattanooga, they said, do you think OSHA is going to come up with a new standard for this? And I said, well, I don't know. Their own rules making process says it takes 4.5 to 9 years to go from an idea to publishing in the Federal Register. But in the meantime, there are still some things that we can do to protect ourselves. So develop an infectious disease preparedness and response plan, prepare to implement basic infection prevention measures, hand washing, computers, phones, et cetera, develop policies and procedures for identification and isolation of sick people, develop, implement, communicate workplace flexibilities and protections. And one of the things that OSHA is saying that you need to do as an employer, this is not a standard, this is a recommendation, is classify your worker exposure to COVID-19. So certain people doing certain jobs are going to have a higher risk exposure than other folks. And this is also from OSHA. It's also in that guidance book as well. And then they talk about workplace controls. engineering controls, that's always the top one. And we're seeing some of these now if you ventured out of your homes, maybe not the air filters, but the physical barriers, the sneeze guards. You're starting to see those now in grocery stores, fast food drive-throughs, et cetera. I think automatic door openers might be something that we see more of in the future, because obviously if you don't have to use your hands to open the door, that's a way to protect yourself. But the big category, I think, is administrative controls. And that's one of the things I'm hearing most from the world when I'm talking to some of the people that we work with in terms of what they're doing, like taking the temperature of their employees when they come through the front door, work schedules in rotation where they're separating the shifts so that they have time to go in and clean, social distancing, which was a term I'd never heard of before I looked it up and found it on the World Health Organization site a couple of months ago when I was asked to start researching ways people can protect themselves. Training, requiring hand washing, and then propping doors open. And that's something that I'm also hearing from some of the folks that I work with, that the interior doors in their buildings, they'll prop open with door stops. Now the fire people are going to freak out about that because they don't want fire-rated doors propped open. But the point is that these are some administrative controls that people are using. And then personal protective equipment. And my goodness, as a safety person who's been in this business for 4 decades, I think I've heard the term PPE used more often in the last 2 months on TV than I've ever heard in all of my life. And they're talking about masks, respirators, gloves, face shields, glasses, and so forth, which leads us then to some key OSHA standards. So I said earlier, OSHA does not have a standard on COVID-19, but they do have standards already in place. And one of them is subpart I of general industry, personal protective equipment. And so if you're going to require your employees to wear respirators, and an N95 is considered to be a respirator, you're supposed to put in a respiratory protection program. That's 1910.134. And if you want to find all this stuff later, please let me know. I'll help you find it. Those surgical masks that they're making at the churches and at people's homes and stuff, that's not a respirator. And I don't really know how to classify that, but it's not a respirator. But the gloves, the glasses, those are all PPE, and they all have training requirements and so forth. OSHA also has a sanitation standard, which talks about hand washing facilities. They've got something called the General Duty Clause, Section 5A1 of the OSHA Act, which says each employer shall provide a place of employment which is free from recognized hazards that are causing or likely to cause death or serious physical harm. The point being that even if OSHA doesn't have a standard for something, they could still cite you under General Duty Clause if there's a national consensus standard. So in other words, the CDC is issuing guidelines, and if your people are exposed to COVID-19 and for some reason OSHA gets called in and they feel like you haven't been following those guidelines and you've been exposing workers, that could be a problem. Bloodborne pathogens, I've got an asterisk by that because the truth is COVID-19 is really not a bloodborne pathogen, at least not yet. It's passed by respiratory secretions, but you'll still see, and I think Mr. Idle may be talking about this later, that when you clean up an area that's known to have been contaminated, they still talk about treating everything like a medical waste, like you'd find under bloodborne pathogens. Another big one that I want to emphasize to you all is hazard communication, working with chemicals. One of the things that I've been reading about lately is nobody's going to the emergency room. Why aren't people going? Well, actually people are going. There's been an increase in emergency room visits due to chemical poisonings and exposures because people at home are trying to create their own decontamination stuff. And when they mix the wrong chemicals, bad things happen. So if you start bringing in chemicals for your people to use at your work site, there's training involved with that, possibly PPE, et cetera. And then OSHA record keeping is another one that can come into play as well. So again, with PPE, I've talked about those requirements. And then real quick on OSHA record keeping, because this is important for the cities out there and county governments. Employers of workers in healthcare emergency response organizations, which would be emergency medical, firefighting, law enforcement, et cetera, and correctional institutions. If one of those employees contracts COVID-19 at work, that is likely going to be an OSHA recordable. For something to be an OSHA recordable, it has to be work-related and it has to meet certain criteria: death, days away, job restriction, medical treatment beyond first aid, etc. Here's the key thing right here, that for everybody else, OSHA is not going to expect you to record it if an office worker or groundskeeping person or something like that contracts it, because it's a public health issue, unless there's objective evidence that they got it at work. OSHA also has things like 7 steps to correctly wear a respirator at work. If you've seen the way people are wearing respirators now, you have to kind of shake your head and wonder, do you really think that the, mask over your chin is going to protect you from breathing that in? I guess if they have their, some breathing apparatus in their chin, maybe that's going to protect themselves. But this shows you how to put it on correctly, take it off, etc. Also, another thing, when we talk about the respirators, the N95s, OSHA says if you're going to require people to wear respirators, or if they wear them voluntarily, they have to be NIOSH approved. Now, OSHA put out this memorandum just a few weeks ago saying, okay, we get it. You're getting N95s from places around the world, not just America. So if you're getting N95s from these countries listed on the screen here, then you need to make sure that they meet these standards from these countries. Okay. Now, I mentioned chemicals that people are using to clean things. EPA has a list in, as in November. Here is the link to that. And that is a list of disinfectants that you can use against the COVID-19. So the page would look like that. You go on down and it shows the product name that you can purchase this. So again, whatever you buy, please check the safety data sheets for that product. Make sure that you're using it properly. And then the Centers for Disease Control, cdc.gov, they've got lots of wonderful information as well in terms of how to clean and disinfect your facility. We've I'm collecting a list of like best practices of what people are doing to protect themselves. And one guy early on, PML out of Paris, Tennessee, Ira Greer, he's given us permission to use this. He put together a lot of good procedures for cleaning, disinfecting teams, et cetera. And again, that's going to be more the detailed stuff that Mr. Ida will get into in just a moment. So I think that I was told 15 minutes. I tried to stick to that. I think I may have missed it by a couple. I apologize. So without any further ado, I'll hand it off to Mr. Idle, and thank you all for your kind indifference.
Thank you all for coming today. I don't know about Brian's lavish praise about me. A lot of times I tell folks, and I mean this with all sincerity, Brian is much more of an OSHA wonk than I am. I'm kind of the person people call when OSHA didn't work or they didn't pay attention to OSHA. So I managed the health, safety and emergency preparedness program for CIS, but I don't regard my coworkers, Brian and Chuck, as coworkers. I regard them as colleagues in the truest sense. So I'm very fortunate in that way. So diving into my part of this, so talking about leaving home and getting back to work, and I'm encountering some of these same things that Brian encountered, in that it is, there we go. The thing that a thing we need to remember is when we're going back into this is not like we're flipping the big switch. This is going to be a exercise in incrementalism. And it really needs to be a planned, organized process, because a successful transition's going to require a lot of patience, a lot of cooperation, and a certain amount of creativity, because as Brian's alluded, this is very much a moving target. During the height of the quarantine, stuff was literally changing multiple times a day. But as you're doing these planning processes and getting people back into the workplace, we don't need to understate or disregard the health and safety aspect of this. So we need to have a plan. So we need to designate internal teams or assigned persons who will make the return to work decisions. And we need to assign a person or persons to monitor legal, regulatory, and compliance updates, because those will evolve over time. And we need to develop or update our continuity plans so that we can respond and react to this stuff appropriately, especially supply chain disruptions. But we need to have a plan A and a plan B. So we need to prepare our plans and have the policies to support them. And we need to look at cross-training as a potential option. So when you're looking at bringing people back to work, there's sort of a phase for the things. So you're going to have things that are preemptive in nature, and that includes cleaning, what you're going to do about PPE, how you delineate work areas, establishing protocols for vendors and visitors, and planning for disrupted supply chains. Those are things that need to be in place before we ever come back. And then you'll have operational issues when you actually bring employees back into the fold. So the cleaning part of it, if a facility has been vacant for over 7 days, the need for a true deep clean is minimized. The longest the COVID-19 virus can live on hard surfaces is about 5 days, which is a pretty long time, but 7 days is longer than 5. If the facility has not been closed or vacant for 5 days, then either using internal or external resources, you need to perform an extensive deep cleaning. It cannot be overstated that before you bring employees back, the place has to be clean. You have to start with a clean baseline. It's also important to know the lingo, because you'll hear people saying regular cleaning or deep cleaning. Regular cleaning is what you would normally do to keep things from not looking like a pigsty. So a regular clean is used to maintain a certain level of cleanliness around the facility. Deep cleaning is when we're really getting into the details, and it's generally a much more involved, detailed process. So regular cleaning is pretty straightforward. Deep cleaning becomes a lot more involved. In broad terms, preparing the workplace for people to come back has 2 phases, and this will be ongoing for the duration of the pandemic and probably beyond. So there's 2 parts of sanitizing. One is the cleaning, and the other part is the disinfection. But you need to have those measures in place and implemented as part of the new routine, or have a schedule created as to how you're going to disinfect workplace surfaces, tables, all these different surfaces, doorknobs and stuff to protect employees. So as you're looking to bring people back, you need to schedule complete sanitation and disinfection of facilities. If you have a person who tests positive for COVID-19, or you have an employee that becomes what they call a PUI, a person under investigation, that will automatically trigger a deep cleaning and disinfection cycle. Now you can either do deep cleaning, either you can outsource that, and there are several companies that have been doing this sort of work for some time, and there are several more that are certainly seizing on the opportunity to come up and do this, or you can do this with internal resources. As far as just cleaning, if you're just doing routine cleaning, you need to wear disposable gloves for cleaning. You need to clean the surfaces. You can use just soap and water. The COVID virus itself has like an envelope that's basically, it's sort of a fatty material. And so, the miracle decontamination fluid like Dawn dishwashing detergent actually will attack the COVID virus because it removes this lipid envelope shield on the virus itself. But the cleaning reduces load, is what cleaning does. It's just like around your house or around the workplace. We're getting rid of the gross, obvious stuff, germs, dirt, and stuff on the surface. But we want to make sure that our cleaning is effective. We want to practice routine cleaning on high-touch surfaces. High-touch surfaces, tables, doorknobs, switches, keyboards, toilets, sinks. So our mindset's going to have to change a little bit as to what is clean and what is not. But remember, for regular cleaning, I can use soap and water for regular cleaning. Disinfection, however, we get into a little bit of a different domain. Brian mentioned the EPA list in for registered disinfectants. If we go to use those, it may create additional demand for the use of PPE. There may be very specific guidelines for how long the surface has to remain wet. So if we're going the route of doing disinfection, then we're going to have to be very familiar with the information on the label of the product and also its safety data sheet. If you want to go old school, you can use household bleach. Usually once you mix the bleach, as a rule of thumb, it's good for about 24 hours. But the household bleach needs to be unexpired, and you need to leave the solution on the surface for at least a minute. Now, a problem with bleach interacts very violently with other chemicals. I guess the good news is if you release a chlorine gas cloud, it will kill several things in the office, but one of them might be you. So it's very important that you take the extra effort to know what you're working with before you start just spraying stuff around the office. There is a requirement for training, whether you're using internal or external personnel. Whoever's doing your cleaning and disinfection and disposal of the waste, at a minimum, they must have training on how to use proper equipment and PPE to perform the task. They have to have all necessary procedures and local authorizations and permits to perform disinfection and properly dispose of any waste that they generate. If you have a COVID positive patient or even a person under investigation, we have to treat all that waste and anything generated from the cleanup of those areas as biologically active hazardous waste, so it would be red bagged. And that would not be something we could just pitch into the dumpster. There's a disposal chain that has to be followed for the regulated medical waste. Also, we have to make sure that they are properly trained in the safe use of these disinfectant chemicals. And as Brian, I think, would tell you, in the world of regulatory entities, there's no federal or state regulatory entity that is spoiling to make your life more difficult during this transition period. However, if something is a slam dunk, just because they're disinclined to enforce does not mean that they will not. And as you train people, it is also very important to document your training because, as with all things regulatory, if it is not documented, it never really happened. So we need to make sure we know how to use the product and we know how to use the PPE to protect us from it. As far as the PPE demands, make sure that your people are properly trained to use the PPE that you intend to put them in. So this is something that needs to be scripted. It may be very different from what you've done before. Different is not necessarily bad, but different is different. So we need to make sure that people have the proper training to use this stuff in the way it's prescribed to be used so that they come out of this safely. The idea of disinfecting and sanitizing places is not to create additional victims. So the PPE that you'll typically see with COVID SARS includes gloves, some sort of respiratory protection, face and eye protection, which is primarily splash protection, and some sort of disposable gown and or coverall. Other things you want to do is you want to define and delineate operations areas and even distancing. So I know that for a lot of us, while we've been sort of under quarantine, going to the grocery store or going to Home Depot and Lowe's, by virtue of they were places that were open, that's become kind of a part of our social strata. But if you've been to Home Depot and Lowe's, you have noticed that they have put in distancing visual cues everywhere. They're on the floor, they've put up pylons, I've seen people use pallets, they have splash shields. There are a lot of clues around that you are supposed to maintain distance, but you need to define and delineate that. So you need to install the visual references so people can see what the distances are. Do not think that people will innately recognize what 6 feet means. I know I went to the grocery store a couple of 3 weeks ago, and what they actually said, 6 feet means 2 shopping cart distances. So you need to put it into a format that people understand. You can install plastic shields. One of the problems with installing plastic shields right now is there's somewhat of a shortage on plexiglass and Lexan to install shields because there's been a sudden surge in demand for it. Another thing you can do as far as delineating distances is actually to consider staggering your shift changes or even doing staggered schedules to reduce the overall capacity in the buildings. So we're already seeing a lot of this in action. You also want to establish what are you going to do as far as vendors and visitors go. So in short, we probably need to discourage visitors from our facilities until such time as it's essential. Something you can do is have visitors or vendors complete a wellness self-assessment. A lot of times that's a form. The only problem with people doing self-assessments is you are kind of at the mercy of their being truthful. And so the same thing goes with your employees when we get into employee self-assessment, but it's something we have to look at. Is if the person looks terribly ill and they're saying, oh, I feel great on their wellness self-assessment, then there's a bit of a disconnect. You can do virtual sales calls, meetings and consultations. I know like today, a lot of us are using Zoom or WebEx and other products a lot more than we had been before all this started, and that will likely continue for a while. You want to limit the number of visitors to a facility to ensure that you have maintained proper distances. You can set the visual marks on the floor. I tell people you need to look at CDC stuff probably once a week or so. You can also post external signage on doors alerting visitors to restrictions on entry and movement in and around the facility, as well as any applicable guidelines and expectations. And I know here at University Avenue in Knoxville, there is signage on the door and signage as soon as you come through the door to kind of let you know what the expectations are. If you have contractors or vendors coming on site, you should request health and travel assessments from them. If we can, we need to separate contractors and vendors from our regular workforce. If we have separate bathrooms or entrances, that's a good path to go. You want to prohibit non-essential vendors and deliveries from entering the facility. So what you'll see in a lot of facilities, they're establishing staging areas. I've actually seen some places that have gone so far as to set up like an easy up tent in the parking lot, and that's where all the deliveries are made and all deliveries are scheduled. And that's requiring the deliveries to be dropped outside to eliminate the vendor from having any need to come into the facility. I've actually seen a couple of places that they have, it's not very elaborate, but it works, but they have garden pump sprayers that have a bleach solution. They actually spray the outside of packages before they ever come in. You want to disinfect the deliveries before moving into the operational areas. And then as part of that, we need to plan for having supply chain disruptions. I think it's been a way to kind of kid my colleagues on the MEP side that this is not a great time to discuss lean methodology to emergency preparedness people, because the concept of just-in-time delivery has not really served them very well during the pandemic. So I think we're going to see, as part of our planning processes, we're probably for certain items are going to start stocking. I'm not going to say hoarding, because that brings to mind, towels and toilet paper. But I think that we're going to see people are going to be a little bit more attuned to carrying forth a greater supply of certain types of items in inventory, as opposed to saying, oh, we can just get that quick shipped in anytime, especially on the PPE part of it. That's been very problematic for the healthcare organizations. So as you start to repopulate the work area, you need to contact your suppliers, whoever you use to transport stuff, or intermediate brokers to let you know you're coming back. You might even want to be considering preemptively ordering things. If your organization uses lots of raw materials, you need to start trying to build those inventories gradually and make sure that you look at the transportation part of it, both on the input and export side of the facility. Good time to look at sourcing alternative suppliers, not being absolutely beholden to a single source or brand. And identify a resource at your agency to monitor the crisis and what the potential effects on your supply chain might look like. But the supply chain disruption part of it, I think, is when, as we dissect this after the worst of this is over, I think we're going to be re-examining supply chain issues pretty intensely. So before we return to work for the new normal, and I'm not exactly sure what the new normal will look like. I don't think anyone absolutely knows. But it's imperative that the employers take appropriate measures to protect the workforce before they repopulate their facilities. That may require infrastructures and adaptations. Plus, the employees must be trained in what the new policies and procedures are before the work ever starts. But things to address in that training would include, but not be limited to, location of sanitizers and dispensers, social distancing practices, procedures, your new cleaning and disinfection protocols, a wellness self-assessment, and what your on-site health screening protocols are, and what do we do if there's an ill worker. So at a base, those are things we need to look at. It would be unwise to presume that people automatically know this stuff. And a lot of it is common sense, but we want to make sure as we are integrating new practices and new procedures that everyone is on the same page. You could have someone who thinks they're doing the right thing, but they're doing exactly the wrong thing. So we need to make sure that we tell everybody this is what the right thing is, and also be honest with them and go, it could change based on the guidance we get from CDC or other federal entities or our local health departments. It could change. As far as social distancing, 6 feet is 6 feet. And 6 feet includes if you're wearing a cloth face covering or a mask. From an administrative standpoint, it will be important to understand that this is going to be a struggle. And for us that were raised in the South, we're huggers. We're huggers, we're backslappers, we're handshakers. In some of our cases, you're going to have decades of habits to unwind. Now, do I think it'll be that way forever? I hope not, but it's going to be this way for a while. So we need to tell them that this is the new expectation and will be reinforced initially, but if people fail to respond to reinforcement, you might have to enforce it through other means. But it's very important to be maintained. Where possible, erecting physical barriers is very helpful. That will not be possible in every office, in every facility, IPS and otherwise. For now, we need to avoid gathering the groups of 10 or more people, entering crowded areas. carpooling with other people outside your home, hugging, shaking hands, eating face-to-face, that would put you at close proximity and increase the risk of contamination. Other things, employees must be reminded to avoid touching their faces, and you must wash thoroughly with soap and water several times a day, even during work hours, to reduce the risk and to prevent person-to-person infection. Prior to resume operations, duties that require employees that work within 6 feet of each other has to be evaluated using a hazard analysis for potential health and wellness concerns. If we can manage shift changes, stagger lunch breaks to allow time to thoroughly disinfect areas and promote social distancing, that will help us in our cause. Social distancing, you know, the clearest way to get a better place in line these days is to cough and sneeze. Used to, that would get you a hateful glare. Now some folks are wound very, very tight about this thing. So if you have a person who looks ill, we don't know why they're ill. They may look ill all the time, but for the purpose of this, if you look ill, you are ill, and we're going to stay away from you. You need to place signage around the facility to remind people to practice their preventive measures. I would tell people some signage is good, don't overload it. If you overload it, it basically becomes visual clutter and people don't pay attention to it. Also, you might want to change your signage just a little bit from time to time to where people don't just kind of glaze over looking at it. If we can, you want to designate one-way walking paths into offices, warehouses, storage areas, any area where traffic can be concentrated. And if we can do this to where it can coordinate to where we're actually doing this in a manner that enhances rather than diminishes safety, I think that would be a little bit of planning time well spent. In some cases, social distancing will be impossible. So if that's impossible, we use barriers between employees at the workstation. Plexiglass, cardboard, or other materials are suitable considerations. The problem with cardboard or porous materials is the virus can live on those materials for a lot longer time, and those materials are innately harder to clean. So porous materials might be something you have to do as a temporary measure till we can get something that is more of a hard surface and that's easier to keep clean. In some cases, we may look at redesigning our jobs. I know in the world of the fire service, and I think I saw Dennis Wolf is on here, in the world of the fire service, the things that firefighters will always complain about is that something has changed or that nothing ever changes. But we may have to reapproach how we do some of our jobs. That's just something that will have to happen. If we can implement other tools or processes to make this more in alignment with what we need to do as far as preventing worker illnesses from the coronavirus, and those things need to be considered. If we can't redesign it, then we have to give them the proper PPE deemed essential to protect their safety and health. You need to have disinfection protocols for your site, and we'll have to decide what are we going to use to do disinfection, who's going to do that, how often are we going to do routine disinfection, and what's going to trigger a deep clean and disinfection. Again, the most common triggers for a deep clean and disinfection is a confirmation of an employee testing positive for the coronavirus or a person who's become a person under investigation. We need to have routine sanitizing, disinfection of facilities. We need to have routine deep clean disinfection, but like I said, it'll be automatically triggered if someone tests positive. But you can do this internally. This is not something that necessarily has to be farmed out. But if you're going to do it internally, the personnel will have to be trained to the task. As far as looking at wellness and ill employee procedures, one of the problems with this virus is it has a very long incubation period. And during the incubation period, you can have people who are capable of transmitting the disease, but they have no visible symptoms. So in very literal terms, you can have a person who's harboring the virus and they have no idea that they are. And so during this time, it is possible for them to feel perfectly well, yet they are transmitting the virus to other people. So we can look at doing self-screening at home. As employers, we can issue a self-screening checklist for employees to conduct a voluntary home screening before they come to work. Things that would be on that: do you have a fever of 100.4 Fahrenheit or greater? If you look at different groups of people, different people have different normal temperatures. Some people have subnormal temperatures, like for my wife, for instance, her normal temperature is like 97.2, where my normal temperature appears to be like 98.1. You have a cough that's not related to known allergies or sinusitis. That's kind of been the bane of our existence in East Tennessee this spring, because we've had an unusually heavy pollen year in the East. And so people that have seasonal allergies, we cough and sneeze just because of this time of year, but it's thrown a completely different dynamic into it with the coronavirus. Are you having shortness of breath or difficulty breathing? Now, and then you want to say, why would a person who's having shortness of breath or difficulty breathing come to work in the first place? I mean, that's a good question, but there are people who are absolutely wired to work, and this having to work from home for some people, just the act of working from home has been very stressful for them, and they cannot wait to get back to work. Now, if you answer yes to any of those, you need to stay at home until you've had no fever for at least 72 hours without use of a medication like Tylenol or aspirin. You don't have any other symptoms, cough or shortness of breath, and at least 7 days have passed since the symptoms first appeared, or you have been tested negative for the coronavirus. As far as employee monitors, employers do have the authority to set up temperature monitoring systems in the workplace and to monitor employees for COVID-19 symptoms. One of the struggles right now is one of the best devices used for this are the quick check infrared thermometers, but there's a shortage of the quick check infrared thermometers. Last time I looked, you're looking at a lead time of about a month. Most employees are not going to be real keen about someone jamming a thermometer into their mouth. And so if you're saying you're going to do temperature monitoring, you need to have that infrastructure in place and ready to go, and have people who know how to use this equipment before you start trying to inflict it on people. If you're saying you're going to do employer-based screening procedures, they must apply to everybody. Top management, floor workers, visitors, anyone who enters the facilities goes through the same thing. If you're going to do employee monitoring, your best bet, if you can, is to designate one entrance where you only have to set this up. Because if you have multiple entrances or portals where employees can come into the workplace, that means I'm going to have multiple teams of people who are doing the temperature checks. And that you need to question, is that really going to be the best use of our resources of employees right now? We want to use no-touch thermometers. If they exhibit a fever upon entrance, the employee should be advised to go home and continue self-monitoring or to get medical attention. And there can be no exceptions to this policy, which means your screeners are going to have to be tough enough skinned that they are willing to be the bad guy and tell people you've got to go home. But if an employee isn't confirmed to have COVID-19, the employer should inform the other employees of their possible exposure in the workplace. You should not, however, say, Bob Jones just tested positive for the virus, because that is a violation of confidentiality. It could be a violation of ADA 90. It could be a violation of certain state laws. It is most certainly a violation of the HIPAA Act. Now, truth be told, the employees will probably figure it out. But as an employer, you are not to say such and such tested positive, but you need to be very generic and say an employee in this work area is tested positive, and this is what we are doing. You need to be aware of this. This is what we're doing in reaction to this. It's not a bad idea to designate an isolation room in larger facilities. So if you have a person who starts having COVID-19 symptoms, you take them to the isolation room if you can't immediately leave the facility. So you designate what that is. You also mark what that is. You strictly limit access to the isolation room to rapid response team members. That would be whoever you designate to take care of symptomatic employees. It has to be stocked with adequate PPE, surgical masks, gloves, respirators, hand washing soaps or sanitizers. And it has to be disinfected and cleaned immediately after the employee leaves. So as far as returning to work, the employee is tested to determine they are still contagious. They have to stay home until these things have happened. They no longer have fever without use of a medication that reduces fever. All other symptoms have improved or have gone, and the employee has received 2 negative tests in a row, 24 hours apart, or following other CDC guidelines. The CDC guidelines are very fluid right now. But individuals with laboratory confirmed COVID-19 who have not had any symptoms may discontinue home isolation when at least 7 days have passed since their positive COVID-19 test and they have no subsequent symptoms. So they've got to be well for at least a week. In the predominance of caution, go with the 2 negative tests. So at this point, be willing to open up for questions. If you would like to contact either Brian or myself, Brian Lane is brian.lane@tennessee.edu, or I'm walter.idle@tennessee.edu. So, do we have any questions? Look like we have a question. Is IPS requiring the use of masks? I have not seen that IPS is requiring the use of masks. I've seen where IPS is recommending the use of face covers. So for me as an emergency responder, when you say mask, I'm thinking N95 or something like that. And they have not required that. Face covers, I think in public areas around the facilities, CDC is still pretty big on face covers. So I would think that that is what IPS is going with. Walter, can you repeat what you said about Dawn dishwashing liquid, please? Dawn dishwashing liquid is very good for cleaning, just for general clean, not for disinfection, for cleaning. But the CDC has found that soap and water does in fact kill the virus. But again, it is a 2-step process. We are cleaning and then we are disinfecting. 2 stages. Any other questions? Let's see. Here's as though there are no, if directives differ from a mayor to a governor to federal officials, which directives are we supposed to follow?
That's a tough question to answer. I would say follow your heart in that regard. So I do have it on good authority that IPS is not requiring employees to wear masks. Masks are being provided. Employees are encouraged to observe all of the recommendations in terms of social distancing. And then based on the information that the Walter and Brian have shared with us today, I think we have a little bit more information that we can make use of in terms of going back to work. In particular, doing a self-assessment and that sort of thing. I see we've got a couple more questions. Walter, go ahead and see what you think.
Okay. If you have respiratory diseases, and that would certainly include asthma, that puts you at an enhanced risk. So that doesn't necessarily, if your asthma is under control, it doesn't necessarily make you a supremely high risk, but you are at an enhanced risk as compared to a person who has no respiratory diseases. That's correct. Is IPS deep clean and disinfecting University Avenue? It's my understanding they are in the process of getting a deep clean and disinfection performed. Wouldn't it be impossible for health check personnel to remain 6 feet from anyone they are assessing? Health check personnel would probably need to be wearing PPE. And that's nothing terribly elaborate, but in most places where you're seeing people doing health checks, they are wearing PPE. From Dr. Bird, our guidelines are to wear a mask or face covering when in confined space or unable to social distance. So there we have an answer. Okay, let's see. From another panelist, will travel off-site for consultants will be allowed at some point in this process. Will CDC guidelines be specific enough to protect us all? That's going to be one of those things where I think the consultant's going to have a very good line of communication with their client to see where their client is and see if you don't feel comfortable doing this, then don't do it. Not right now. That's the simple answer. In the cleaning, the disinfection of this document that Brian alluded to from CDC, it has a lot of really good detailed information on how to clean different office areas and such. CIS will also be coming out with a return to work playbook in the near future. They'll actually have everything that's in the CDC document, plus things as to how to clean your vehicles and stuff like that. So there are resources out there, but I think as we gradually merge into more normal work as we know it, that it's going to be, it's not going to be something that happens automatically. And certain consultants have to go into areas that are innately more hazardous than others. I think we have to, you have to protect yourself first and foremost. And then if you feel fundamentally uncomfortable doing it, then this is not the time to do it. Any other questions?
Well, I would like to give a shout out to CIS and to Walter and Brian for providing us with this wealth of information, and Paul, thank y'all. Do y'all have any parting comments or words?
I just want to thank you, Scott and Susan Robertson, for your help in putting this together. And thank Walter Idle and Brian Lane for sharing your expertise with us today.